Hi, 5 Congress of Nanobiotechnology and Bioengineering. My name is Cristian. I can present the posters titulate The Synthesis of Nanocapsules of PLGA with Outside of Magnesium as a Carrier for doxorubicin Potential Treatment for Ovarian Cancer. The authors is my person, Cristian Felipe Siabato, Mariana Huitrago, Carlos Maya, and the leadership of the group, Luz Dari Gutiérrez Castañeda. We can represent the Fundación Universitaria de Ciencias de la Salud in Bogotá, Colombia. For introduction, we can ovarian cancer runs the teen mortality due to its difficult detection and rapid metastasis. The treatments typically involve the chemotherapy agents like anti-neoplastic drugs such as doxorubicin are on the most used therapies in the treatment of cancer. We have, however, its use generate systemic toxicity and cause the side effects harmful adverse events with negative effects to quality of patient lives. The DOTS mechanism which inhibit the tumor cell replication but also affect not tumor cell, causing adverse effects. The experimental alternatives include the targeted therapy using controlled drug delivery via nanocarriers as a ceramic materials and encapsulated out to polymers as polylactic-glycolic acid (PLGA) that increase their ability to direct it to a specific site. The objective for these studies to propose the synthesis of magnesium oxide nanoparticles functionalizated with doxorubicin as active ingredient and encapsulated in PLGA and evaluate their impact on ovarian cancer cells. The methodology for this is we can propose the process of synthesis using a co-precipitation process and functionalizate with doxorubicin. The result of the co-precipitation process, we can optimization via a three-factor Bose-Benkel experimental design and the physicochemical characterization of the nanocomposite with using the dispersion light scanning, atomic force microscopy, and scanning electron microscopy. The effects on the cell viability in ovarian cancer, cell lines, MESO-B, and OutCar3 was assessed using the mitochondrial activity assay MTT. As a resultant and discussion, we can determine the independent variables of flow, striving, and temperature. We propose the optimized level to the flow 5 microliters per second, spreading 400 RPM, and temperature to 20 grades Celsius, and determine the dependent variables to particle size, polydispersion, and efficiency of the reaction. We can observe the particle size 25 nanometers, the polydispersion 0.335, and efficiency to 28%. This is a answer surface to determine the influence of the independent variables to dependent variables. I can evaluate. This is a AFM microscopy to determine the particle size in 25 nanometers. And this is a zinc microscopy to determine the formation of complex with the doxorubicin and oxide of magnesium nanoparticle. And this is the encapsulation of the complex in PLGA. For the cytotoxicity analysis revealed that the nanoparticles exhibit the pH-dependent activity. We can determine the inhibition concentration. We can compare the concentration of inhibition of dots in MES and dots in OTCAR with the complex we can propose the dots in outside of magnesium nanoparticles. We can determine the inhibition concentration for the MES in 58 micrograms per milliliters and the OTCAR in 25 micrograms per milliliters. This For conclusion, the future evaluation in 3D models incorporating other cancer microenvironments components is very necessary to validate the model of the nanocarriers as a chemotherapy. Okay, thanks for your attention.